Levokast belongs to the respiratory system drugs group and is supplied in blister packs containing 30 ordoxine tablets. The active ingredients of Levokast are Levocetirizine dihydrochloride and Montelukast. Each tablet contains 5 mg of Levocetirizine and 10 mg of Montelukast. You can find the list of excipients included in the medicine in the final part of the video. The information you will hear in this video has been prepared using the official patient information leaflet in order to inform Levokast users. If you find this video helpful, please support us by liking the video, subscribing to the channel, and turning on notifications. What is Levokast used for? Levokast is an antihistamine medicine used in the treatment of allergic conditions. Its active ingredient, Levocetirizine, reduces the effects of histamine, which causes allergic reactions, thereby relieving symptoms such as runny nose, itching, and sneezing. Montelukast works by blocking leukotrienes that play a role in asthma and allergies, helping to reduce inflammation in the airways. Levokast is used in the treatment of allergic rhinitis, asthma associated with allergic rhinitis, and chronic urticaria in patients aged 15 years and older. Asthma is a chronic disease characterized by persistent inflammation of the airways. Its symptoms include cough, wheezing, chest tightness, and shortness of breath. Allergic rhinitis develops in response to allergens such as pollen, house dust, and animal dander, and causes nasal congestion, runny nose, itching, and sneezing. Urticaria is an allergic skin condition characterized by itching, redness, and raised wheals. How should Levokast be used? You should always use this medicine exactly as prescribed by your doctor. The recommended dose of Levokast for patients aged 15 years and older is 1 tablet once daily. Tablets should be swallowed whole with a glass of water and should not be chewed. Levokast can be taken with or without food. The medicine should be used regularly for the duration recommended by your doctor. Levokast does not relieve acute asthma attacks. During an asthma attack, a rescue inhaler should be used. When does Levokast start to work? In allergic rhinitis, symptom relief may begin within the first few hours. In asthma and chronic allergic conditions, the effect usually becomes noticeable after several days of regular use. However, irregular use during an asthma attack, discontinuation of other asthma medicines prescribed by the doctor, or persistence of allergic symptoms may reduce the effectiveness of Levokast. Important information before using Levokast. Do not use this medicine if you are allergic to its active ingredients or any of its excipients. Levokast is not recommended for patients with severe renal impairment. Use this medicine with caution if you have difficulty urinating due to conditions such as prostate enlargement or spinal disorders, if your asthma symptoms worsen during treatment, if aspirin or certain painkillers worsen your asthma, or if you have previously experienced mood changes, depression, or behavioral disorders. If you are pregnant, planning to become pregnant, or breastfeeding, consult your doctor before using Levokast. This medicine may cause drowsiness, fatigue, or dizziness in some patients. Therefore, caution is advised when driving or operating machinery. Levokast should not be used together with alcohol. Levocetirizine may affect the central nervous system, and alcohol can increase drowsiness, reduce alertness and reflexes, and intensify dizziness and fatigue. Possible side effects of Levokast. Common side effects include headache, drowsiness, dry mouth, nausea, vomiting, and abdominal pain. Rare but serious side effects may include behavioral changes, depression, palpitations, skin rash, and increased liver enzyme levels. If you found this video helpful, please support us by liking the video and subscribing to the channel. You can share your opinions and experiences about Levokast in the comments section. Wishing you healthy days.